start?
My name is Sonia Ehrlich-Sachs. I am a pediatrician by training, public health specialist, and I am the health coordinator for the Millennium Villages Project, which, as you know, is a proof of concept that indeed Millennium Development Goals can be reached, that extremely poor communities, such as those in sub-Saharan Africa, can be helped to get out of extreme poverty or out of the poverty trap, given or if helped with a package of integrated interventions to help with increased food production, access to clean water, access to healthcare, infrastructure, and education. My specific portfolio is to help the communities do something about the extremely high morbidity and mortality, especially of children under 5, and mortality of women surrounding around pregnancy. As you probably know, in sub-Saharan Africa, 1 out of 5 children die before they reach the age of 5, and about 1 out of 9 women die because of issues related to pregnancy and delivery. And the remarkable thing is that all of these deaths are pretty much preventable and certainly treatable, and it is only because of the deep poverty that these communities in rural sub-Saharan Africa find themselves in that they are not being approached and dealt with. The remarkable thing for me is to realize that the child morbidity and maternal mortality really is due to 3 categories, and only 3 very basic categories of issues, and therefore they're extremely approachable. The 3 categories that are responsible for about 80% of the excess disease burden that these communities suffer are infectious diseases, nutrient deficiencies, and safe childbirth. It is these 3 categories that are responsible for the huge morbidity and mortality and for the huge excess disease burden that is suffered by people in sub-Saharan Africa. In infectious diseases, again, it is things that are that we absolutely know how to take care of. We have the technologies to deal with. In infectious diseases, it's AIDS, TB, malaria, diarrheal diseases, as simple as diarrheal diseases, respiratory diseases, helminthic or worm problems, and other parasitic disorders, and vaccine preventable disorders. So in the infectious category, it is all entities that we have already developed technologies, that the rich world has technologies to both prevent and or treat the disorders. In the nutrient deficiencies, of course, it is mainly iron, folate deficiency, vitamin A deficiency, zinc deficiency, protein deficiency, and a caloric deficiency, all extremely preventable if the right agricultural interventions are taken. And then the 3rd category being safe childbirth. As you all know, most babies are born without any skilled birth attendant. They're born in the mother's hut, frequently just with a relative or a traditional birth attendant, with no equipment and no emergency network that can be called upon if there is obstructed labor or hemorrhage. And so childbirth is a very highly risky event for a young woman's life. So the point that I would like to leave you with in this part is that the unacceptable, tragic morbidity and mortality in sub-Saharan Africa is due to these 3 categories, all of which contain ailments that are preventable and treatable. So what are the interventions that we're advocating in the Millennium Villages Project to try to combat this unacceptable situation? The interventions are manifold, as I mentioned earlier, and as other speakers I am sure have mentioned, is that like all organisms, a human being also is a sort of a multifaceted organism, and you can't approach any problem, you can't approach it with just one solution. So the intervention for the health sector, I would divide into two categories. One is all of the things that you can do outside of the clinic before you even talk about needing any clinical establishment, and then those that you do need some clinical or medical expertise. So the interventions to combat child mortality and maternal mortality, in terms of interventions that can be done outside of the medical system, are just simply increasing food production. That is first and foremost, because most of the diseases that I mentioned before, most of the infectious diseases, the underpinning problem is malnutrition. So increased food production so that children and women are able to have the appropriate amount of calories and micronutrients is critical to being able to withstand the diseases, especially those that are common in the tropics. Water, clean water, critical, because of course the diarrhea, which is a huge cause of morbidity and mortality of children, diarrhea is due to contaminated water, and as you all know, most families living in very remote rural areas of sub-Saharan Africa, which is after all where 80% of Africans do live, people do not have access to clean water. You often hear stories of women, you hear stories and you see when you're walking on the road, such as we do, women walking hours and a couple times a day, walking for hours to bring back water. And when you look at the quality of the water source, it's usually something that you and I would not want to be drinking from. So the water source is absolutely critical because it's the source of a lot of the ailments, mainly diarrhea and some other parasitic diseases. And transportation. Again, it's an intervention that has a huge impact on health, but it's outside of the clinic sector. So if a child is very ill and needs immediate care, or if a mother is in labor and her labor is not going smoothly, she has obstruction, what you need first and foremost, before you even start thinking about a hospital and a clinic and the clinicians, is you need first and foremost a way of communicating, a cell phone to call for help, a road that would take you to a clinic, and of course some mode of transportation. None of these things are available in most of the areas that we're discussing. So this is a package of interventions that impact very importantly on health, but are still outside of the actual sphere of clinical or medical intervention. So to summarize, it's of course critical is adequate nutrition from enough food, safe, clean water, and then infrastructure. Then, of course, in order to be able to address the problem of morbidity and mortality, you do need to address the public health sector specifically in and of itself. And what I can say about the public health sector in the countries in sub-Saharan Africa, especially the ones that we work in, is that the public health sector, pretty much like all the other sectors like agriculture and education, infrastructure, it all pretty much ends at the sub-district level. Being the governments having such a low budget, are barely able to set up structures in the capital cities and some of the main cities, but there's almost nothing if you look, from the sub-district level down. So